jurisdictions other than Tasmania. So we have 4,860 cases now and 20 deaths, unfortunately, throughout that. I can say that, again, we've had that some idea that the curve is in fact flattening. We haven't had a large increase since in the last 24 hours, although the numbers continue to increase. So in terms of the measures that have been introduced, I think there is good signs now that that is actually working as we had expected, and I think this is full credit to the Australian public who have really taken on enormous changes in their lives over the last few weeks. Still, up to now, the majority of cases that we have seen in Australia have a link with international travel, and as we know, that border restrictions that happened a few weeks ago now have happened, and so we're seeing less people coming from overseas. The majority of the rest of the cases, the local transmission of cases with no overseas travel history, are still from known clusters of cases, so people who have there's an obvious link to a case, and that's how they presumably came in contact and developed the disease themselves. So that's an important component. We still the other main issue to discuss today is around the flu vaccination. So that was launched this morning. So as of now, there are millions of vaccines out there ready, either delivered already through to the states and territories as part of the National Immunisation Program. And I would really encourage and really stress the importance this year in particular for people to get their flu vaccine as soon as they can, in the normal way, through their normal general practice, through their pharmacist or various workplace-related vaccine providers. This is particularly important for those in our community who are most vulnerable for the COVID-19 problem as well as flu. So unfortunately, this is a double burden for our elderly members of our community. I have many relatives that are in that situation myself, and I'll be encouraging them quickly to get their flu vaccines. But not only the elderly, but also those with chronic diseases, some of them the same chronic diseases that make them at risk of COVID-19 severe disease. So people with diabetes, heart disease, lung disease and cancer. But in addition, of course, the usual people that we think about in terms of a flu season and protecting them is young children, Aboriginal and Torres Strait Islander people, particularly those over 50, and pregnant women. So pregnant women and young children at this stage don't appear to be at high risk of COVID-19, but they certainly are at risk of flu, and they should be considering getting their flu vaccine as soon as possible. So that's the main message for today. I'm happy to take questions.
Can you confirm the modelling shows peak demand for ICU beds towards the end of April, or at least a surge in cases towards the end of April?
I'm aware of a paper that's been published in the Medical Journal of Australia. I've commented on that paper before. I believe their modelling is not really based on the situation here in Australia. If we were to peak in April, we are in April already, of course, then that would be a good thing. It would mean that we're not getting a lot more cases. But really what we're seeing in terms of the epidemiology of the disease here in Australia, we are continuing to get more cases, but that curve is flattening. And rather than thinking about a peak, we should be thinking about a long haul, and that's really the most important thing.
But you're not worried about the end of April and the pressure on ICUs and perhaps cases rising?
No, we have very few cases in ICU at the moment, and throughout the whole epidemic so far in Australia since January, we've certainly seen less than 100 cases that have ended up in intensive care. So we have thousands of intensive care beds. One thing I would say is that many of the restrictions that we've had in recent times in our society, difficult as they are indeed leading to a decrease in some of the other things that often end up in our intensive care units. The change in elective surgery will be part of that, but also trauma cases that we see from car accidents, from violence around some of our night venues that are well publicised in the media, because those venues are no longer there, and we're not travelling as far or indeed as fast possibly as we have previously done. Some of those things that are often filling our ICUs with those unfortunate events are not happening. So the capacity has increased. The other thing that has been announced in recent days is about the true partnership now between private and public hospitals. That has also increased our ICU capacity, and we're working on many other methods to increase our ICU capacity over time. So at the moment, there is no pressure on our ICUs.
So you mentioned the early positive signs. Three states that have the biggest outbreaks, Queensland, Victoria, New South Wales, are now trending toward a doubling rate of just every 7 days. Given that we are likely to soon see the end of those larger overseas cohorts arriving, and we now have such strict restrictions on people's movement, what is next in terms of if we do flatten that curve? Are we just sitting effectively for 6 months in the position we're in now and waiting? How does the next stage work?
So at the moment there is very good signs, as I mentioned, and as you've said there again, particularly in the states that have the most cases. And so this is very good news, but it's not time to take the foot off the brake. We need to continue those measures, possibly for some months. We haven't yet arrived in winter, and that we need to see what that does in terms of the epidemic here in Australia. In the Northern Hemisphere, where they have the epidemic has started in winter, we've seen some disturbing scenes. But I think in some countries in Europe, even in the middle of winter, so Germany is a case in point, where I think our epidemic in Australia is much more similar to Germany than it is to some of the other countries we're seeing. So in terms of what happens next, I think it's a case of wait and see, but certainly continuing what we are doing now, because it appears to be working, that doesn't mean we just we stop those measures. Indeed, we need to continue to do them.
Professor Kelly, you and some European countries are making face masks mandatory, and the US is reconsidering their advice. Will Australia be reconsidering its position that only people with symptoms should wear face masks in public?
Masks are an important component of our personal protective equipment, not only for people that have symptoms, but I'd say, to answer your question specifically, people with symptoms should, if at all possible, stay at home and not go out at all. But if they do need to go out to seek medical care, for example, then the use of a face mask would be good. I recognise that face masks are a concern in terms of the supply. We've had some good news in recent weeks, but particularly in the last couple of days, with several million masks arriving in the country. We're continuing to look at ways we can increase our supply through local manufacturing, but that continues to be an issue for us in terms of personal protective equipment. I'd say just on the personal protective equipment, I think it's very important that we really put that towards our healthcare workforce, aged care workforce. They are the front line that we all need to be protected to continue to work.
So well, people who are well should not be wearing face masks in public. It won't protect them from the virus.
They shouldn't be using face masks in public, because that would be a waste of face masks.
Again, just on the modelling, a couple of days ago you said you strongly believed in transparency and that you'd be releasing modelling soon on the expected curve in Australia. Have we made any progress on that? I have been quoted as saying I would release the modelling. I'd just like to clarify that we will discuss the modelling, and we will look to make that transparent in coming days. But modelling, I just really want to stress, modelling is something that's used by many, and some other countries have released some of their modelling in recent days. But modelling is only a component of the way we're looking at how we can deal with this process, and that has been important up to now. But we really have our local epidemiology, which is very much open, and we report on it every day at these briefings. It's on the website and so forth. And that's really what's guiding most of our decision-making at the moment. I guess some members of the public might like to see where this might end or how it might play out, and that would reassure them and also restore public trust in some of the authorities and how they're handling this crisis. And
perhaps that's why governments overseas have chosen to go down that path. Do you accept that argument?
Look, I think transparency is a very important thing. Modelling can be misinterpreted, and we need to make sure that that is presented in a way that is useful. The other thing I would say about modelling, and modellers themselves would also say this, modelling is not necessarily the truth. It's a way of seeing the world and potentially pointing out how one can influence certain scenarios. But if we knew the truth and we could see exactly what was going to happen in the next few months exactly, then we don't need to model. We would know the truth. I think one more there. Yeah.
Regarding a vaccine, there's been some more talk in recent days about how soon we might see a vaccine. If 18 months is actually optimistic. Do you see the end of the coronavirus as being the cure or actually the containment, given how hard we're hitting basically all levels of society right now?
So, yes, a lot of speculation about the vaccine. I know that there are enormous funds have been put into vaccine research around the world. Our very own Jane Holton, who's here, was Secretary for Health previously, is involved with the CEPI project. That's an international group that is looking in epidemic preparedness in general, but specifically in vaccine research. And so that was set up some years ago after previous pandemics, and particularly around the Ebola crisis. So there is this group of researchers around the world very much linked in to develop a vaccine. But vaccines for coronaviruses are not easy. In fact, up to now, we've never had a successful vaccine against a coronavirus. So this is experimental times. How long it will take, estimates have varied, but at least months, probably 12 months, possibly 18 months. This is a difficult thing to predict. So I think we, of course, are hoping for a virus, but we can't just wait for a virus. And so therefore, we're using what we have right now, which are the public health measures that we've all become aware of in recent days.
Do you think we're capable of eliminating the virus without a vaccine then?
I don't think we can eliminate this virus without a vaccine, no.
Professor Kelly.
That's Paul Kelly, the Deputy Chief Medical Officer.